Hello, everybody, and welcome to our Monday live stream in the Thrive Beyond Pain community. And I'm coming here on my floor today because I wanted to talk to you about 3 effective exercises that you can do if you are struggling with back pain, which I know so many folks are because 80% of people at some point in their life will struggle with back pain. And for most people, it's lower back pain. So that's what we're going to talk about today. I'm going to sit on my cushion here. But we're going to talk about mostly lower back pain, although this is really going to be helpful for you if you are experiencing pain in your upper back, in your mid back, wherever it is. I think you're going to find this really helpful. And if you're new to this group and this is your first time joining one of these live streams, please introduce yourself, say hello, and let me know where you are tuning in from. And also, I wanted to let you know that next Monday we're going to be having an exciting live stream. It's going to be with Dr. Nadorf, and she is an ER physician, an ER doctor. And the live stream is going to be on the topic of how to be a smart patient. So she teaches doctors how to shift their perspective and shift the lens of how they look at their patients and how they may classify a difficult patient and how they can shift their thinking around. So if you've ever felt like you've been the difficult patient, I know I felt like that before with my doctors when I was really struggling with chronic pain and I was looking for answers, I was looking for help, and I felt like I was being labeled as a difficult patient because I was being my own advocate for my own health. So if you can relate to that, pop a comment below. I definitely know how that is. And so we're going to be talking about this and going into this in next week's live stream. And so that's going to be on the 14th at 5 p.m. We're going to go ahead and stream it live into this group. And we're also going to be joined by Tracy Chester from the Pain and Trauma Institute of San Diego, and she's going to be jumping on as well. She's a licensed marriage and family therapist, so it's going to be a great group of folks hosting this live stream. So I hope to see you next week as well. Okay, so let's go ahead and jump in to today's topic, 3 exercises for back pain. And I first want to start by discussing why would you be experiencing back pain in the first place? What is going on there? We did a live stream on this a few weeks ago. If you're also interested in watching that one, we did a deep dive just into that topic. The whole live stream was just on that topic. You can send me a DM and I will send you the link to that live stream, or you can find it in the guides section under pain relief. But we're experiencing pain in the back for a number of reasons, but the number one reason that I've found when working with my clients over the last 20 years is it has to do with immobility, just not doing enough movement. So maybe that means we're, not getting enough movement in our daily life. Maybe we're sitting at a desk for too long throughout the day. Being in one position throughout the day is one of the worst things that you could do for your back when it really comes down to it. And so that's what we really want to take a look at, is what positions are you in throughout the day? And as I've mentioned before, the position is not the problem. It's the lack of movement that's the problem. So it's the fact that we're not varying our positions throughout the day that is the issue. A lot of folks get a standing desk because they think that standing at their desk is going to cause them less pain than sitting at their desk, but then suddenly maybe they develop plantar fasciitis or some other problem from standing too long throughout the day. So what we really want to do is move the body more, change our positions, change and vary our movement throughout the day. I have a workbook on this. I know I've sent the link to a couple of you guys before. If you haven't received that workbook, I go into this. I talk about nourishing movement, how to change your position throughout the day. I give you some tips and ways that you can discover new movement patterns and take a look at maybe how your office is set up so that you can set yourself up for success and feel good throughout the day. You shouldn't be at pain while you're sitting and working throughout the day. Your clients or whoever you work with need you and need you to feel best in your body. And so you're really doing them a service if you take care of your body while you are working on your tasks throughout the day. So if you're interested in that workbook, you can comment workbook below. And the idea that I wanted to introduce today, it's called the joint by joint approach. And that means that our body is designed in this perfect, incredible way where each joint has a role and has a job. And one area of the body, one joint is meant to be stable, while the other is meant to be mobile. So I'll give you an example of how this presents throughout the body. I'm going to just shift my view on the screen here. So the way that we see this in the body is for instance, our ankles our ankles are meant to be mobile. So if they're stiff, then that's where we first want to take a look is what's happening in the ankles. And that's why we want to take a whole body approach when looking at the body. We can't just look at the low back in this box. The body doesn't work like that. We need to take a look at the whole body. And that's what I do in my movement and health assessment when I work with clients in my programs. So the ankles are meant to be mobile, the knees stable, the hips mobile, the low back stable, the shoulders, the mid back, the ribs mobile, or upper back, thoracic spine mobile. Shoulders should be, the shoulders are a tricky one. The shoulders we'll do a whole nother live stream on because the shoulders do need a lot of stability to prevent injury. That's why so many folks struggle with rotator cuff injuries and tears, but we'll go into that another time. There's so much to talk about. I get so excited about this topic because there's so many just very simple and powerful things that you can do if you're in pain to work with this. So moving up the body, the neck was meant to be stable. So we look at the joints like this and it's a perfect design. But what happens is if, say, we're sitting throughout the day, then that's going to create this tension in the hips, this immobility in our hip joints, that those joints are meant to be mobile. And another area of the body is going to have to compensate for that. And so we usually go up one joint. So that's either going to be the knees. So you may be experiencing knee pain because your hips aren't quite doing the movement. They don't have the range of motion that we need. Or you may be experiencing pain in your low back. So this is very common when it comes to sitting too much throughout the day. Our hips get stuck in the same position all day long. They're not getting that nice fluid range of motion that they were meant to have. And then our back, a lot of times when we sit, right now I'm sitting on this Zafu cushion. It's a meditation cushion, and I really like to sit this way because it's comfortable for me, because I'll just turn to the side so that you can see my spine. When I'm sitting here, I'm able to sit more upright in a neutral spine. Okay, so you want to be able to sit on a surface where your hips can be a little higher than your knees. That's usually what's more comfortable for folks, to sit like that. So I suggest that clients work on this. They work on sitting on the floor. If you are able to still sit on the floor, you want to keep being able to do that. So you want to keep practicing it. It may feel like an exercise at first. It may feel really kind of uncomfortable at first. But the more you work on mobility of your hips, like we've been talking about, the more you practice it, just like anything else, practice makes permanent. It's going to get easier and easier over time. Okay. So that's the theory of the joint by joint approach. We want to take a look at the body through that lens because it really helps us gain an understanding of what the body needs and what our joints need and why you may be experiencing pain. It just really simplifies it. Okay, maybe your hips aren't moving enough and you're not getting enough movement also in your upper back. Oftentimes when we're sitting at a computer throughout the day, the shoulders are rounded forward. And I don't just see this with people that have, office jobs or tech jobs. I see this also, say, with new moms who are holding their newborn throughout the day or carrying a child around. They have the same issue going on. They are hunching forward a lot because they're holding their baby, and then their spine's not doing the movement it was designed and meant to do. And so therefore the lower back is going to compensate for that. And just to explain this a little further, just because the lower spine was designed to have stability doesn't mean that it shouldn't have any mobility at all. So a lot of folks are experiencing less range of motion than is ideal in their lower spine. And so one of the ways that we can work with the pain that they're experiencing is just to get those joints to move more throughout the day, starting with some gentle therapeutic exercise and then maybe working our way up to doing more movement throughout the day. Because, for example, if you held your arm in this position for 8 hours, it probably would start to hurt, right? And then, if you began to slowly straighten your arm, it's going to be stiff and tight, right? And it's not going to be moving as well. And so that's going to take some time to get that moving and get the elbow moving. And okay, now the stiffness is kind of going away. It's starting to feel better. Oh, good. Now I have more range of motion in my elbow. Oh, now I can move my shoulder. Oh, that feels good too, right? So that's what it's like when we first start moving our spine, right? I think it was Iyengar who developed Iyengar yoga who said we're as young as our spine. I think that's so true. So if you are experiencing a condition like stenosis and you have, nerve pain, or you have a herniated disc, then, these exercises actually should be okay for you. But of course, I'm not a doctor, so I would, always recommend to check in if you are concerned about your health with your healthcare provider. But I did develop this very short routine of these 3 exercises today for, most folks to be, pretty safe for everyone's body. Okay. So with that said, we're going to go ahead and get to these 3 exercises today. And the first one is going to be working on that hip mobility that we were just speaking about. And what we're going to do, there's a lot of different ways that you could work on mobilizing your hips, but for most folks, we need to stretch our hip flexors, to stretch the quads, these tight muscles in the front of our hips. So I'm going to show you how to do that. So you'll want to have a mat, and if you're watching the replay, then you can just pause this here and go ahead and grab yourself a mat. If you have knee pain being on your knees, then you can put some padding here under your knee. And you're going to go ahead and step 1 foot forward between your hands. And this is called a low lunge. We're just going to take a couple long, deep breaths here, breathing in through the nose and out the mouth. Very good. And so that stretches the attachments of the quads. That's what we call the hip flexors. There's no muscle called the hip flexor. What we mean when we describe the hip flexors are the quads that go up the front of the leg and then they attach. Some of them go right inside of your hip joint and help to stabilize the hip. And again, that's why it's important to address these muscles, make sure that you have the right amount of mobility and length in those tissues. When we come upright with our spine, now this becomes more of a psoas stretch, okay? So we're just gonna start to bring the pelvis forward in space until you feel that stretch now, maybe up the front of your body. If you bring your shoulders over your ribs, over your hips, that's also going to help increase that stretch. We just want to take a few long, deep breaths here. And if this feels uncomfortable on your back knee, then you can always keep your hands down here. I'm going to show you another modification to do. I'm going to grab a few blocks. Always nice to have some yoga blocks that you can use. And you can take these blocks and place them to the side of your mat. If you felt a little compressed or crunched in that position, then you can go ahead and do it this way with your hands on a few blocks like that. Very nice. Okay, so in the interest of time, I'm not going to do the other side, but that is the first exercise that I would suggest for back pain is stretching your quads, your psoas. These are all called hip flexors. Your psoas is your primary hip flexor, so that's a really important one to stretch. And that's how you do it. Okay, so the second one that we're going to go into is called the book opening exercise. I also like to call it the alligator mouth exercise. If you do have that block, you don't need it, but if you have the block, you might as well grab it, and you're going to lay on your side. And you're just going to go ahead and put that block between your knees. Okay. And this is going to help to stabilize the pelvis. So you have your knees bent. You're keeping your pelvis nice and stable. Then you're going to bring your top arm in front of you. You're going to take a deep breath in, float the arm up to the ceiling, and then you're just going to slowly reach the arm back as you open your chest to the ceiling. I'm bending my elbow just because I'm hitting this wall behind me, but you can keep your arms straight. And then we're going to paint a rainbow on the sky as the arm comes back down in front of you. And I suggest doing that 3 times. So here's the breath. It's really nice to also use the breath to help you go a little deeper in that rotation. So on the inhale, your arm is going to float up to the ceiling. On the exhale, you're going to rotate your chest open, spiral your chest open as the arm reaches back. And notice how I'm keeping my hips stacked. I'm not allowing my pelvis to go along for the ride. And I'm going to bring the arm back down. So what we're working on with this exercise is thoracic mobility. So your thoracic spine is your upper spine. And there's 12 vertebrae there in the thoracic spine. It goes down to T12, which is the lower ribs. So that's where we want to think about twisting from, the upper back and the rib cage. And as we talked about earlier, the thoracic spine should be mobile. So we're mobilizing the thoracic spine so that our lumbar spine can stabilize, right? Because we want to work on opening this all up. We're also getting this nice stretch in the pecs. This should be a really good exercise for you if you do sit at a computer all day or you're hunched forward and you know that you want to work on your posture. This is a really great posture exercise because it opens these muscles up in the chest. Okay, so also do that on your other side, but again, just in the interest of time, I'm only going to show these on one side. You can do these on your own. So that was the second exercise called book opening, and that is for your thoracic mobility, the mobility of your upper back, so that your lower back can do its job, so that it can stabilize. When your lumbar spine is stable, then it's going to help protect you and prevent injury so that you don't, like, say, herniate a disc when you go to pick up a heavy object because you have that nice stability in your spine. Okay, so this next one we'll go ahead and we'll come down onto our backs. We're going to work on hip and pelvis, the connection of the lumbo-pelvic area. Hip, pelvis, lower back. Okay, so like we talked about before, hip should be mobile, but low back stable, right? So that has to do also with the pelvis. So this whole area, stable, mobile in the hip joint. If you have too much mobility in your pelvis, then you may be struggling with SI joint pain. I did a live stream on that a few weeks ago. And that is something that you can help relieve when you do these exercises. So what we're going to do is we're going to find a neutral spine. This is kind of a 2-for-1. We're going to do a few pelvic tilts. Most people know this exercise, especially if you've done physical therapy before. It's where you're going to imprint your back, like you're sinking your back down towards the mat, and then you're going to make a little arch. So you're going to imprint your back and then make a little arch. And the way I like to explain it is you're imagining that you have like a blueberry under your lower back, and on your exhale, you're going to squish that blueberry. And on your inhale, you're going to revive the blueberry. So you only want that little bit of space. You're not doing like a huge back arch here. You're just creating, you're basically facilitating that natural curve that we have in our lower back. And we just did that a couple times. That's a great exercise as well. But since I was only going to do 3 exercises today, we're not going to count that one. That's a bonus. But we did that exercise so that you can find your neutral spine. So the neutral spine is where you have a little blueberry under your back, okay? And that's the position where you have the least amount of force and pressure on those discs in your lower back. So really important to be able to find your neutral spine, okay? Now I'm going to keep my ribs down. That also helps me maintain the neutral. And all I'm going to do is bring my right leg up and bring it down. And then bring my left leg up and bring it down. So this exercise has more to it than it may seem. I'm not just, mindlessly lifting my leg. What I'm doing is keeping all of this pulled in. I'm thinking about drawing my abdominal wall in. As I exhale, I'm going to lift my leg. As I inhale, I'm lowering it back down. Keeping my ribs down as I do that. I'm feeling a nice deep fold in the front of my hip. And here's, if you're a more visual person, here's an image that you could use. I'm going to imagine that there's a fishing rod in my belly button, and the line is attached to the top of my thigh, and I'm thinking about reeling it in as I lift my leg from my belly button. So there's a reason why I'm saying it like that, describing it like that. For one, our powerhouse comes from our core, right? The center of our body. So we want to think about lifting from those abdominal muscles. But the other thing is that it's our psoas that lifts our leg, as I mentioned before. We don't really have to get into the anatomy of the psoas to understand it, just to know that this is the muscle you want to be recruiting when you're lifting your leg. You want to be in relationship with your psoas. It's a really important muscle. We stretched it before, which is great. Now we're actually strengthening it by doing this exercise. Your psoas attaches your spine to your hips, so very important when it comes to back pain. If your psoas is tight, it's going to be pulling your spine into extension. It could be pulling on the discs of your back as well because it attaches to your spine. We can talk more about the psoas in the future, but I just wanted to introduce that today as a concept of feeling your psoas working to lift your leg. Feeling it coming from this deeper center of your body, right? If you want to feel, I know somebody's going to be interested in this, so let's just talk about this for a second. If you want to feel your psoas, bring your leg up to tabletop. You're going to press your hand into your thigh. With your other hand, you're going to see if you can feel your psoas firing. See, as you do this, as you push your thigh into your hand, you should kind of feel a muscle pop up. It's right near your belly button. It's like an inch lateral or an inch away from your belly button. You should feel it pop up. So that's the muscle you want to recruit. So just do a couple more of those, seeing if you can feel that muscle working.
And another goal of this exercise is to keep the lower back stable, as we've been discussing. So the lower back is going to have no movement as your leg is moving. Beautiful. So that was the last exercise. Pretty easy, right? And if you just did those 3 exercises every day, which would take you about 2 minutes to do, they don't even take 1 minute probably each, then you probably would start to find a lot of relief because, like I said before, this is how our body was designed and how our joints were designed to move. Okay, so if this is something that was interesting to you today and you want to dive deeper into this and learn more exercises as well as more resources and tools that you can use, whether you're experiencing back pain or really any other type of pain, there is a remedy for it. There is a pathway to relief. And I'm really excited to present my new 6-week course. It's called Pain and Stress Relief Reset. It's going to start in October, so coming up in a couple weeks, October 21st, and it's going to go until November 25th. It's going to take you right up to the holidays, so right before Thanksgiving, so that you can enter the holidays really feeling your best, feeling energized, feeling just embodied, and having a real sense of relief because we're going to be doing a deep dive into therapeutic exercise that you can do for pain relief. We're going to be going into breathing techniques that you can do for stress relief, somatic exercises, nervous system regulation exercises that you can do for stress. And we're also going to be going over some nutrition tips so that you can nourish your body from within and really reset so that you can set yourself up for success, especially to enter into 2025 already having arrived at the goal. Because how many times have you gone through the holidays and then gotten to your New Year's resolution and thought, wow, I actually feel worse than I felt before because now I have been so stressed and running around like crazy and dealing with whatever it is, my family or whatever experience you had during the holidays. So that's why we're going to start out the holiday season feeling our best. So if this is interesting to you and if you want to learn more about this, then I will pop the link below. You can check out the website for this course. But really the best way to learn about it is to connect with me. So go ahead and send me a private message, or you can comment below in the chat, connect, and I will go ahead and reach out to you. We can set up a call. I can talk to you a little bit more about this 6-week course coming up in October, Pain and Stress Relief Reset, to see if this would be a good fit and something that would be helping you to achieve your health and wellness goals, because that's what we're all here to do. So I hope you found this live stream interesting today, and please join me next week with Dr. Nadorf. She's an ER doctor. We're going to be talking about how to be a smart patient. I'm really looking forward to that live stream next week, and I will see you all in the group this week. If you're watching the replay,